This week marks 4 years since Maine started seeing confirmed cases of COVID-19 in the state. Quickly, our lives changed, businesses closed, and we started wearing masks and learned about social distancing. And many of us also lost loved ones. According to the Maine Centers for Disease Control and Prevention, 3,377 people in Maine have died with COVID-19 over the last 4 years. Good evening. Thanks for joining us here on News Center Maine at 5:30. I'm Zach Blanchard.
And I'm Chris Costa. Since March of 2020, many aspects of life have gone back to seemingly normal, but the virus is still spreading in some of our communities. The latest report from the Maine CDC shows 57 people in the state are currently in the hospital with the virus.
News Center Maine's Ann Baldridge joins us with a look at where we are with COVID now here in Maine. Ann?
Hey, Chris and Zach. Right now, 9 of those 57 patients are in critical care and 5 of them are on ventilators. So how did those numbers compare to the middle of March back in 2021? Well, at that time, there were 86 Mainers hospitalized with COVID-19. 26 were in critical care and 8 on ventilators. Maine's COVID numbers reached their highest ever on December 21st, 2021. On that day, 387 people were in the hospital, 125 people were in critical care, and 62 people were on ventilators. Dr. Dora Ann Mills is a former Maine CDC director and the current Chief Health Improvement Officer with Maine Health, the state's largest healthcare system. Mills says that there have been clear changes with the way we deal with the virus, but it's still something we need to take very seriously. She says we can't look at COVID quite the same as the flu or other seasonal viruses.
COVID is certainly a more severe disease than influenza and RSV, and that it's more likely to cause hospitalizations and death. But it is certainly becoming a lot more like influenza and RSV, and that we're just seeing it around, but much less so than we did even 2 years ago, because we've got vaccinations and people know if they're sick with a respiratory virus to mask so you can protect other people.
Dr. Mills does say that people, especially in more vulnerable groups, might need more frequent COVID boosters and updated vaccine. Chris, back to you.
Ann Baldridge in the studio tonight. Thanks so much.